Good morning, good evening, good night, doctors, nurses, and pharmacists. I'm DrChe, and today we will discuss one discharge letter. So, first, we will discuss the case notes, and then I will mark your letters. I will teach you how to write the letter. Okay, we will do the complete discussion of the letter, and I will mark your letters. Okay, those people who have sent me the letters, I will mark them also. So if you're watching us on YouTube, on Facebook, you can comment below. You can share this session with other doctors and nurses. Those who are with me on Zoom, you can also share this session with other doctors and nurses. So we are just going to start this session very soon. Just give me 1 minute to share the session and then we will continue. Okay, if you can also share with your friends, those who are taking the same exam as yours. So if you can share the session with them, that would be great. If you can't share, then it is also great. Okay, don't worry. Okay, so can you see my screen? I think yes. Okay, let me give you permission to unmute also. Okay, so now you can unmute and talk with me also. Just let me see. Okay, so those guys who are on Facebook with us, you can comment anything if you wish, so I will be able to see. Okay. Okay, V2026, please switch off your cam. Please switch off your cam, okay? Okay. So these are our case notes. Okay. So can you see the case notes on my screen? Anybody can unmute and can talk with me if you wish.
Yes, sir. It's
Yes,
showing.
doctor.
Yes, sir.
Okay, thank you. Yeah, I'm a shy person. I'm trying to go online with my video. Let us see if it helps or not. Okay. By the way, I'm teaching OET for more than 2 years, 2 years and 2 months. But I mostly don't go online with video. But now I am trying to overcome my shyness. Okay. Okay, so these are the case notes that were written by me myself. Okay, when I have written them just 2 months ago on in November. Okay, so I have many more case notes with me, new one that were written by myself. Okay, so I have arranged the case notes in such a way that both doctors and nurses can get benefit. Okay, so both of you can write letters and you can send me. So first, what we will do, first we will discuss the letter case notes. Then I will give some important, tips how to organize this letter, how to, do all the things, and then I will mark your letters. You can ask me any questions. Those who are with me on uh, Zoom, and those who are on Facebook, you can also comment. And I'm, seeing your comments also on my mobile here. Yeah, yeah. Okay. So, first of all, like in the real exam, so when you get case notes, it means you're writing exam. So you will get answer sheet. You will get this sheet also, the question, case notes, and then you will have 5 minutes to read the case notes. Okay. Can anybody tell me what we can do in these 5 minutes?
Doctor, plan.
Plan. Okay. What else? What else?
And understand the case note thoroughly.
Okay. So first of all, in these 5 minutes, we cannot, write anything on paper, or we can not even pick the pencil. Okay, so we cannot write anything, we cannot even underline the important points, so you can just read. Okay, so what you will do is first you need to quickly read. Okay, so first you need to quickly read the case notes, to whom you are writing, how many visits are there. Okay, so once you finish reading quickly, then you need to start planning in your mind what type of letter it is. Is it discharge letter, referral letter, to whom I am writing, is medical professional, semi-medical, non-medical, what is relevant, what is irrelevant, how I will organize the letter. So all of these things you can quickly do in those 5 minutes. Okay. So now let us do this in with this letter. Okay. So because if I start talking, in air, you will not understand a lot of things. So we should do practically, okay, with this letter. So first of all, so if you go here, just your doctor, nurse, and read the case notes, okay, complete the task. So we will quickly go to the task, okay, the task that is at the end. Choosing information in case notes, write a letter to this doctor for further investigations and surgery. So this is the information about the doctors. So what I understand, even I have not read these case notes. Once I have written them 2 months ago, now I'm just reading for this class. So what I can understand, you are writing this letter to a surgeon for some further investigations and surgery of this patient. Okay. So this is a referral letter. Okay. Then quickly go and start, reading. Just patient name, gender, female, date of birth, admission date, discharge date. Okay. So this is a social background, married, children. So this I'm doing quickly. You need to do like this in the real exam. Okay. Quickly. I'm not reading each and everything. Okay. Married, children. Okay. Part-time waitress. Okay. Diet, fast food. Past history is smoking. Here is drinking, BMI, allergies. Okay. Interception in childhood, treated with enema. Okay. Otitis media. Okay. Then we have family history, obesity, and aunt, uncle, okay, and father, depression, okay, takes fluoxetine. Okay, so this is our past history. Then we have our visits. Okay, can anybody tell me before we start reading the visits what we should do? Anybody can tell me? So we will discuss purpose everything. Okay, can anybody tell me?
We should look at the dates of the visit.
Yeah, very good. Who is that?
Dr. Hamza.
Okay, Dr. Hamza, very good. Okay, so Dr. Hamza, VIP hybrid course.
Yeah.
Okay, okay. So you know these things. Okay, one of my students. Okay.
Okay.
So Dr. Hamza, when you have written first letter, I was happy that even your English level is better than mine. But as you know, when
Thank
once
you.
we started writing letters, there were case notes that were difficult, and then we started having sometimes C plus also. The rest of the
Yes.
letters you keep getting B, but in some letters you start getting C plus also. So the reason is
Yes.
we need to, write a lot of letters to be well
Yes.
prepared for the exam.
Okay.
Okay. So, but are you happy with the correction that we are doing?
Yes.
Okay.
Definitely.
Yeah, okay. But you are referred by one of my old students, so you should pass. Okay. I get a little bit worried like that.
Inshallah.
Okay. Okay. So here, so we have first visit. Just see the dates before we read the details. Okay. 15 of 10, 22. Okay. Then 19. So we have gap of 2 weeks. 19, 10, 22. Then admission at Newton Hospital is written in capital. Then we have 15, 11, 22. Then we have 20, 11, 22. And this is the discharge plan. This is the last date. So we have 4 dates. Today's date. This is the admission, 15, 11. We have 29, 10 of October, and we have 15 of October, 4 visits. Okay. One is admission, 2 are visits. So, okay. So now we should start reading. Okay. Here in the last, mostly they write the diagnosis also in the plan. So cholecystomy. So as you know from the file that we have acute cholecystitis, so we are referring for this operation, this surgery. Okay. So Dr. Hamza, you are surgeon, you write very good letter. Okay, I know.
Thank you.
So yeah. Dr. Hamza asked one day, when I get, reading and listening exam questions that are related to my profession, I do very well. But when it is like psychology, psychiatry, and these things, I get problem. So we have this visit. Patient comes with a upper quadrant. So we will do quickly. Okay. So this is the pain, severe pain. These are all the details of pain is leaves with this and everything like this. Okay. No jaundice and these things. So the pulse is Dr. Abdullah Khan. Please stop your video. Okay, so examination, this shows pulse, this everything is normal. I think everything normal, just BMI is 30, and just a little bit mild tenderness in right upper quadrant, and you are suspecting cholelithiasis. Okay, because there is no fever, nothing. You're just suspecting stones. Okay, if some nurses don't know these things, cholelithiasis is just stones. Okay, so you are suspecting this. So what you have done for patient, you have done you have run some investigations, really requested some investigations, and you advise the patient to take diclofenac, okay, diclofenac, and you have advised these things, and you schedule a review in 2 weeks, okay. What happens after 2 weeks? On this date, patient comes with no improvement, pain increased, but no jaundice, no nausea, no vomiting, no fever. Examination is normal, only mild tenderness in right upper quadrant. As this was a scheduled review, okay, revisit. But here you have the investigations. This is the main thing of review. We have scheduled the review to see the investigation. It's not like our countries where you do all of these things on the same day. In developed countries, for example, in UK. So if patient comes for something mild, okay, mild to moderate, so they in the GP surgery, they do investigations. So they run investigation, they take the sample, and patient comes after 1 or 2 weeks to discuss the, investigations with the GP. So the ultrasound shows some stones here and lipid profile was deranged. And you have given diclofenac the same medication and you have added atorvastatin, okay, due to deranged lipid profile, and you have advised again on lifestyle modification. Okay. So far we have just, case of cholelithiasis, means gallstones. And if in first patient came, you suspected this, then you have done investigations, and then you found some, stones and lipid profile was deranged, and you started the patient on this. Then there is a new hospital admission on this date on 15/11/22. Patient came with severe pain in right upper quadrant. So all of these are details. This pain was radiating here and there with fever and with jaundice, then vomiting, then pulse is high, blood pressure is okay, and saturation is 19, the temperature is there. So now this is infection, okay? BMI is 31 still, so Murphy sign is positive. Little bit difficult letters for nurses to write, but still, as our main thing is how to write, how to use the medical language, how to write visits and these things. So you nurses don't need to worry. You will not get a little bit difficult language like this in the real exam. For you will be like dressings, like wound care, but sometimes you also get visits, okay? So it's good to learn how to write the good language, and you will see doctor's letters and you will improve, okay? So on this visit, on admission, you are suspecting acute cholecystitis due to gallstones. This is now your current diagnosis. And you continue patient on diclofenac. You have given, morphine, strong painkiller, and you have started the patient on antibiotics. Antibiotics for 5 days. After 5 days, you review the patient. Antibiotic course has completed. The patient's condition has improved. Good evening. Okay, so patient's condition has improved and there is no fever and no pain. And this is your discharge plan, is very important, okay? Continue analgesics, decrease weight, and eat healthy. Okay, this is for you, okay? As maybe you are a medicine in the medicine department, wherever, okay? So this is not too important for the surgeon. For surgeon is main thing what you want, okay? So you want from the surgeon, refer to the surgeon, further investigations. This is MRCP and possibility. This question mark means possibility of surgery. Again, I'm saying it's a little bit difficult letters for nurses, but still we need to learn the language, how you need to organize the information, how you need to do all of these things, okay? So now we know the overall situation of this letter. So what is happening? And now anybody can participate. Anybody else? Any nurse can participate?
Yes, doctor.
Okay, so Miss Anila, so what is in your eye, what you have understood about this letter? So is it like referral letter, discharge letter, transfer letter? What kind of letter is discharge plus transfer,
Yeah,
discharge plus referral? What type of letter this is?
I understand that is referral letter.
Yeah, referral, but is also like a discharge also, because you are also going to discharge the patient, is discharge plan here also. Is discharge at the same time you are referring to another specialist, okay?
Yeah, surgeon. Okay, doctor.
Okay, so is discharge plus transfer or referral letter, okay? So mostly discharges towards GP, but here we are we're discharging the patient at the same time we are writing this letter to the surgeon, okay? No, so what we follow in this letter, chronological order of importance?
Can I answer?
Yes, please.
I think chronological.
Chronological, okay? So Vivo, please stop your video because Vivo. Okay, so chronological, why? What is the reason?
Because it's not something urgent.
It's not something urgent. Any other reason?
like her condition is improved already. So, and she's going for like going to we suggest that might she will be elective MRCP or surgery. So it would be like elective. It's not something else.
First of all, it's not something urgent. Other thing is, for the surgeon to understand the situation better, we follow first the patient came, I was suspecting only stones. Okay, like this. So for example, Dr. Hamza is a surgeon, like really he is a surgeon. So like I am a GP and I am sending this patient to Dr. Hamza. Okay, so Dr. Hamza, this patient came to me with stones. Okay, I done some investigations. We found 3 to 4 mm stones, and I was just suspecting cholelithiasis, and I gave him I gave him a painkiller, and I found some deranged lipid profile, and I started the patient on atorvastatin. Patient went home. Okay, then Dr. Hamza will ask, then why you are sending me this patient? Okay, what happened, Dr. Hamza? This patient came, you know, 4 weeks ago to the hospital with symptoms of acute cholelithiasis, this jaundice, fever, and all of these things. Okay, then what happened? Then I have given the antibiotics and the patient improved. Today, patient has improved. Okay, so then why you are sending this patient to me? So as there are stones, I want you to do MRCP, test, and I want you to evaluate for surgery. Okay, as I'm not sure it needs a surgery or not, that is why I have written question mark with surgery. Okay, surgery would be cholecystectomy. Okay, so I want the surgeon to evaluate this patient, to do MRCP, further investigation, specific investigation. Okay, and then evaluate if there is need of surgery or not. Okay, so this is, you need to do this like in the real exam. So when you have some time, so quickly understand the situation. Okay, now other thing is, you can see there are 4 visits today, then admission, and then we have 2 previous visits. If you write each and everything in this letter, how many words would be there? Because it seems to me everything is important for all of you also. But if you write each and everything, how many words there would be in the letter? What do you think?
Around 250.
No, more than 250. Even in the 2 previous initial visit, you can write more than 200 words. So it would be very long letter if you write each and everything. Okay, very long. Okay, so we need a concise letter. What is the purpose to write a letter? You can send these case notes to the reader also. So this is the complete history of the patient. Read it. Okay, and everything would be there. So why you are writing a letter? Just think as if you are in the real, situation in a hospital. So you have these notes. You can send a copy of these notes. So why you are writing a letter? Why? Mostly we write resume like this in the discharge plans. Okay, when we are sending this patient over. So the reason is just you need to organize and write the main and important things, because now if you write each and everything, doctors and nurses are busy, health professionals. So if you write each and everything, they would not have time to read all the things. Okay, you just need to give the main things. Okay, the main things, so that they can easily and quickly read and understand the situation. Okay, so now, so we have organized all of things. We have planned how we will organize the letter, how we will do everything. So now let us decide about the purpose. Okay, so if we will have purpose in this letter, then we have 15 of October visit. Then we have next visit of investigations, 29. This is my planning, because if I start writing without planning, I will write a very long letter. Okay, then I have admission of 15 of November. Then I have, we can write today, okay? Then we will write the conclusion, okay? So this is how we will organize this letter. So we need to be very, concise here, especially in the previous visits, because we don't need to give a lot of details, because if you write a lot of details, so your letter will be very long, okay? So first let's write the purpose, okay? Can anybody tell me what we need to write in the purpose? Can anybody tell me what we need to write in the purpose? I can see your comments on Facebook also. So Tavida, Dhaka, Sarwan Kumar, Rabia Ramzan, Siman Javed, Minisha, all of you are active. So what we need to write in the purpose?
Referring for the investigation and surgery.
Okay. Can anybody tell me what is the purpose to write a purpose? This is a question, yes? You can start writing like this. This patient came on first date like this and this and this. Then on next date, this happens. So why are we writing a purpose? Can anybody talk with me?
Yeah,
me,
to
sir.
highlight the
Just like highlight the main thing, okay? Just like the headlines in the news, okay? When you see news, first they say, so this thing happened, and then in the bulletin, when they explain the things in detail after the main headlines, then they explain in detail, okay? So this is just like your headlines, okay? So in the purpose, we write two things. Number one is very easy to write a purpose if you know the basics, okay? What is wrong with the patient? That mostly is diagnosis. And number two, what we want from the reader. An old before OET 2.2 to OET 2.0. So before that, in the purpose there was no strict rule for purpose, so you can write anything in the purpose, just a little bit long. But now there is strict rule. The purpose should be concise to the point. It should be, you should get at least 2 out of 3 in purpose if you want to pass your writing. If you get 1 out of 3 in purpose, even if your rest of the letter is good, you will still fail, okay? Okay, so let's write this. I'm writing, it's very easy. I'm writing. We can use advanced level, but let's go for, basic one. I'm writing to refer is Miss, and then we will use the surname, the second part of the name, okay? Miss Robbins is Kathy Robbins, okay? Kathy Robbins. So we will use Miss Robbins, okay? Surname. Miss Robbins, comma. We can use here age plus the profession of the patient, okay? So this is optional. You can skip. Mostly I skip, but you can use if you wish, okay? So who? Now we need to see the diagnosis. If you see here, in the first visit, the diagnosis is cholelithiasis, even it is suspected with question mark. In the second visit, you see the multiple stones. So cholelithiasis is confirmed. Now, on the admission, it is acute cholecystitis due to gallstones. And yes, so what is our main diagnosis? What we will write? Cholelithiasis or acute cholecystitis?
Acute cholecystitis.
Acute cholecystitis, okay. Okay. Who has acute cholecystitis, okay? And what she needs? It is written here. Investigations and surgery.
Yeah.
Okay. So she need is wrong grammatically. She needs, okay. No, you can see purpose. So number one, what is wrong with the patient is acute cholecystitis. And what we want from the reader is investigations and surgery. Do you think the way I have written, I can get 2 out of 3 in purpose? Even I have mentioned the main things. What do you think? What do you think?
I think yes.
Yes, but difficult because it needs a lot of improvement. Okay. So who will help me to improve this purpose? Who will help me?
Excuse me. Yes, sir.
Okay.
We should highlight that the investigation is a general word. So we should proper write the investigation in the surgery name.
Yeah, that could be. That's good thing. So you can mention exactly the surgery if you want. Cholecystectomy. Okay. Okay. So if you wish, you can just mention surgery here and we can write exactly in the conclusion. So both are okay. Anything else? Polite way, yes, very good. Simon Javed, very good. Dr. Hamza will help us. Dr. Hamza? No, not there. Okay, anybody else can help me? She would require your kind assistant.
I can write like
Sir, can I tell you?
Yes, please. Yes.
I
Sir,
am
if
writing.
Yes.
hello.
I am
Yes,
writing to
please.
refer Mrs. Robbins,
Yes.
who has diagnosed acute cholecystitis.
Who has diagnosed
Uh,
acute cholecystitis?
she
Sir, can I add something?
she is being discharged today.
She is being discharged today. She is being discharged today. And then
Therefore, she needs further investigation and surgery.
therefore she needs
Further
further
investigation and surgery.
investigations and surgery. So you will be writing 3 sentences. Okay, somebody has written on Facebook, Rabil Somoro. I'm writing to refer Ms. Robbins, whose
Can
sign and
I tell
symptoms
you,
in
sir?
keeping with. Just 1 minute. So cholecystitis, she needs investigation management. Dr. Rabil, it can be improved. Okay. Yes, please.
Sir, if we write, I am writing regarding Mrs. Robinson,
Mhm.
who was admitted to our hospital recently due to acute cholecystitis.
We don't need to mention hospital or hospital, these things, because this is just to the point. Okay.
Okay,
So
sir.
who has been admitted is okay. Grammatically is okay. Okay. So
Okay, sir.
I can help you a little bit. Instead of writing who has been admitted, we can add who has been treated for.
Okay, sir.
Okay. So we will write here. So just let me copy here again. So who has been treated, okay, for, okay, acute cholecystitis, okay. Now my diagnosis is complete, or you can add something in the diagnosis.
Acute
yes.
cholecystitis owing to gallstones.
Yeah, owing to, due to, okay. So owing to is IELTS word, okay, owing to instead of due to, okay. So in OET, just please take my advice, okay. In OET, you need to keep things simple, easy. Simple and easy. You can easily pass your exam. but only the reader should understand what you are saying, okay? So just use the same due to, okay? Due to gallstones, okay? So first sentence is improved. No second sentence. Who will improve the second sentence?
Can I?
Yes, please.
Yeah, your further investigation and management would be appreciated, highly appreciated.
So let's go a little bit specific. So if you see here, your further investigations is okay. Even we can your further investigations including MRCP, okay? And what about surgery? You will write directly surgery or you will add something for question mark?
Might need it.
I think possible surgery.
Possible, yeah, possible, very good, okay. And possible, okay. So she needs further investigation. She would require further investigations and possible surgery, okay? And a surgery if needed, the other way, and surgery if needed, okay? You can write even cholecystectomy here, okay? You can write exact surgery, name of the surgery, cholecystectomy, okay? So now it is almost okay. So the student who has corrected this letter, this part, what were your score in the previous attempt that you have taken?
C plus.
Exact score?
It was 310.
310, okay. And how many letters you got corrected in that attempt with me?
I think around 10 or maybe above.
I think
Actually,
was
I forget.
15, between 10 to 15, okay.
Yeah, actually.
And how long ago?
Almost 1.5 years.
1.5 years ago, okay. So this is my experience. So I have been teaching for a long time, so people have been improving a lot. So the student got problem with other modules, but she passed the writing. Now she is taking the classes again because she is going to take the exam again, okay. So we have VAP hybrid course that you will get, letters corrected. We'll discuss, your letters individually, not like other tutors, because I'm, doctor like many of you, and I'm your colleague, so I just focus on quality instead of quantity. Okay, so we have written the purpose. Then we will go to the first visit, okay? So who can just quickly help me how we will write the first visit, okay? Yeah, so here is Fazal Ghufran. Okay, so he has written purpose. Let us read this. Fazal Ghufran, okay. So I'm writing regarding Miss Robbins, who has been diagnosed with a cholecystitis due to gallstone. Is okay. Who has been diagnosed is okay, acceptable. I would prefer who has been treated for, okay. Now she is being discharged. Okay, after now you can even put comma. Now she is being referred to you. Now instead of being referred to you, you can refer here. She is being discharged and would require, further investigation, including MRCP. Okay, so she is being referred to you for MRCP and for no need to write again and again for again, okay, just possible cholecystectomy. Okay, this is also good way. Okay. So now let us write first visit. Okay. So I will just quickly tell you how we will write the first visit. Okay. So this is visit. So let us see how we will write. Okay. So patient came with pain in the right upper quadrant. It was severe. It was sudden. It lasted for 5 to 10 minutes. There was no radiation. Patient, this pain was aggravating after meal. It was postprandial. So you can just use postprandial. Okay. It was relieved by diclofenac tablet. It was associated with nausea. There was no fever, no vomiting. There was no jaundice and no change of color in urine and stool. Okay. So we will write just one sentence, and we don't need to write each and everything here, because if you write each and everything, your sentence would not be good, okay? We will just write the main thing. The patient came with, okay, on this date, Ms. Robbins presented with a severe onset, okay, a sudden onset, severe onset, no, a sudden onset, severe pain in right upper quadrant, okay, that lasted for 5 to 10 minutes, okay. You can add something also with no aggravate if it's no radiation, but radiation, there is no radiation, we can skip, okay. So just write the main things, okay. Don't write each and everything. Just one sentence is enough for this part, okay. If you write each and everything, your letter would be very long. Okay, and then in the examination, what we will mention? The negative things we can skip. Negative, no jaundice, no change in color of stool or urine, we can skip, okay. No radiation, we can skip, okay. No nausea, vomiting, we can skip. Just write the main things, okay, important things. In the examination, what we should write? Anybody can tell me?
Yes, mild tenderness in right upper quadrant and
Yeah.
BMI.
Yeah, BMI, okay. So this is main thing that we will write. You can even write her vitals were normal, okay, and then we will write, you know, examination. But you can also skip if you were, okay. Then we have investigations and treatment. Should we write, so then further investigation, including FBC, LFT, RFT, these were ordered. So, or we should use something else.
I think we can write blood workups.
Blood workups is a little bit, you know, not formal word. Some relevant investigations were ordered. Okay, this mostly we use, were requested or were ordered.
Okay.
Some relevant investigations were ordered and she was commenced on, or she was prescribed, she was commenced on, okay, diclofenac tablet. Okay, tablet even we don't mention diclofenac. And lifestyle management, okay, you can sign and advise to change the lifestyle like this. So write as one thing in general, don't write each and everything about exercise, weight, and if you write each and everything, then your you know, paragraph would be long, okay. Just let me open the model answer. I will show you how I have written this. If I, you know, start writing again, it would be very long, okay. So here, initially on this date, Miss Robbins presented with a severe and sudden onset pain in the right upper quadrant of her abdomen, which lasted for 5 to 10 minutes, as I already mentioned, okay. So this is how we can write. It was associated with nausea, okay. I think there were nauseas, okay. There nauseas were there, okay. Associated with nausea, okay, yes. So you can see I'm using relieves, associates, I'm using present tense, but as when you are writing letter, it would be a past visit, so you will use past tense, okay. Sorry. So it was associated with nausea, aggravated after meals, and relieved by diclofenac. So I'm writing, you know, extra things in one sentence. So now in the examination is normal, except for mild tenderness in right upper quadrant and a BMI of 30, okay. Then cholelithiasis was suspected and some relevant investigations were ordered. Even I have skipped diclofenac and these things because that was not too important, this treatment, okay. I have skipped them, just I have written cholelithiasis was suspected and some relevant investigations were ordered. This is important for me at this point, these things, okay. So I have skipped them. Okay, so now quickly, somebody tell me what you will write in the next visit, okay. Next visit. Somebody else, okay, not missing me. Somebody else, please. Anyone?
Sir, may I?
Yes, please. So how you will quickly write this?
She represented after 2 weeks.
No need of represent. Yeah, after you can after 2 weeks,
After
Miss
2
Robbins,
weeks
okay, Miss Robbins, okay, and then you will write, okay, okay. Then what you will say?
with the same complaints.
With the same, it's not same complaint. You can there was no improvement in her condition, okay,
Okay.
okay, okay. What else?
And she underwent an ultrasound was performed and which revealed that multiple small stones 3
Okay,
to 5
so
millimeter.
good. Okay, so you were right. There was no improvement in her condition, and she still had mild tenderness in her right upper quadrant. You can write like this. Okay, please mute, please. What is this? People start, doing this. Okay, so this there was no improvement in her condition, and she had a mild tenderness in right upper quadrant. You can write again, but as she is already having this tenderness, you can skip it. So what about these investigations? These are normal. You can skip them. And what about lipid profile? So you can just write, instead of writing their details, her lipid profile was deranged. And her ultrasound showed multiple stones of 3 to 5 millimeter in gallbladder. Okay. So Miss Anila, can you repeat what about you will write about investigations?
Yeah. Ultrasound was performed which revealed small.
Okay, just stop here. Okay. So you told me ultrasound was performed which revealed. Okay. So now you are making the simple thing difficult. Ultrasound was performed. This is a common mistake of many students. Ultrasound was performed, which revealed. Okay. So the simple thing is, her ultrasound showed multiple stones of 3 to 5 millimeter in her gallbladder. It's very simple language. Okay. But I am
Okay,
using.
doctor.
So you are making the simple thing difficult and you will lose marks. Because we don't need to show off high level of English in OET, because in OET you need to keep things simple and easy because you are writing to another doctor or nurse. It's not like IELTS. Please be careful. Okay. So her investigations showed deranged lipid profile, and her ultrasound, or you can her blood results showed deranged lipid profile, and her ultrasound showed multiple stones of 3 to 5 millimeter in gallbladder. Okay, then you will write investigation. Treatment here is important now because you are adding something, Lipitor, atorvastatin 20 milligram once daily. Okay.
Okay, doctor.
Okay, so you will write very shortly like this. Okay. Okay, 2 weeks later, there was no improvement in Miss Robin's symptoms, and her investigation. You can directly. I'm not writing now the tenderness in this. Her investigation revealed deranged lipid profile and multiple stones of 3 to 5 millimeter in her gallbladder. Okay. So the dose of diclofenac was increased. So something that you didn't notice, the dose of diclofenac is being increased here. So you don't need to mention exactly how much because this is not the concern of the surgeon. Okay. And she was commenced on new medication, atorvastatin. Very simple. Okay. Now this is the admission same as we have written in the start. Okay, at the start there were no fever and these things, so there are some new symptoms. So you will write the admission. On this date she was admitted, and there were these symptoms, and then you will write the positive things in the examination, and she was commenced on antibiotics. Okay, morphine and antibiotics for 5 days. Then you will write today's visit. Today her condition has improved and her antibiotic course has completed. Okay, and you can write a discharge plan. So what I have done here in the conclusion, let me show you. So this is the admission. So even I have written today's visit at the end of admission because this is not long. Okay, this just you need to, her condition has improved today, and after the completion of antibiotic course, or you can write the course of antibiotic has completed. Okay, I would be grateful if you could I would grateful if you could. Okay, just 1 minute. Let me listen to the call. Okay, so sorry, I got a call. Okay. Okay, so today's visit, this part you can write at the end of admission. Okay, as I told you here, you need to decide according to the situation. So this today's visit or discharge, we will write here at the end of admission, and then we will write the conclusion. In conclusion, we will write the discharge plan, what we want from the surgeon. Okay. So any question? Now let's start marking your letter. So any question so far? Any question?
Yes, sir. I have one
Yes,
question.
please. Yes, please.
The discharge plan which you in the case note is not compulsory to put in the letter because it's not relevant to the surgeon.
Yeah,
Or
this is
should we not?
continue analgesic, decrease weight, eat healthy. This is not for surgeon. Okay.
Okay.
So you can see discharge plan has two parts. One part is just the patient will follow at home, or the GP will follow, or the community nurse will follow. And other thing is specifically for the surgeon. So this part of the discharge plan is not needed. Okay. So mostly, and this refer to the surgeon for this you can easily cover in the purpose or in the conclusion. So you don't need to write a separate long discharge plan. Mostly in nursing letters, there is a long discharge plan, like you need to continue physiotherapy, and then you need to change the dressing daily, and you need to check the blood pressure and this and that. So it's not like that. Okay. Okay, any other question? No?
Excuse me, sir, one question.
Yes, please.
Maybe it's very simple for the others, but as I'm new to the OET, the abbreviation, I read in so many things that we should not use the abbreviation.
Should not use abbreviations.
Yes, sir.
Okay, can anybody help Dr. Khan to answer this question? Because I'm going to see a patient. I'm coming back. So just try to explain, okay? Just one person, not all of you start talking. Just I'm coming back in 2 minutes. I need 1 or 2 minutes. I need to see a patient. Anybody can explain him, please?
May I, sir?
Yes.
Hello, Gufran sir.
And yes, yes.
Yeah. You can use universal abbreviations like liver function test, LFTs, CBC, and other universal like hypertension, HTN, diabetes D, diabetes mellitus. But those abbreviations which are not mostly common in a medical language, so you must have to avoid from that.
Okay, thank you. So somebody was explaining. So abbreviations, we can use normal, abbreviations. Like, for example, I had one doctor, for example, for hypertension, what do you use? HTN, yeah? HTN. For blood
Yes,
pressure,
sir.
we use BP, okay? So for diabetes, we use
DM.
DM, okay? So these abbreviations you
DM.
can use, okay? You can use. Just a few days ago in December, I had one student that was doing her internship, means house job. So she was in gynae rotation. And I think this was her third attempt or second attempt. Yes, I think so. Or maybe first attempt, but no, it was her second or third attempt. Okay, she got problem with writing in the last attempts, 2 attempts. And she sent me a letter. She wrote BOP, something like bad obstetric history, BOH, like this. Anybody uses this term in your words?
No.
Bad obstetric history, BOH. Okay, she wrote in the real, letter that she sent me for correction, BOH, bad history, bad obstetric history. Okay, the patient was having, history of preeclampsia or, something like that. So this abbreviation we don't use in, normal and common. It's not common. Please don't use abbreviations like that. Okay? Common abbreviations we can use. Okay. And she took exam 3 times. This was her third attempt, and she was even in house job. She was very tough time there, but she passed after she joined my VA habit course. Okay, so now let us, Miss Anila is there.
Yes, doctor.
Okay, so let us quickly mark your letters. Okay. Oh. Okay, your greeting is okay. Just we need to write everything on separate. Everything should be simple, capital, every first word. Just
Okay.
type a mistake here. Okay. So one is blank space here, one blank line here. Okay. So this is okay. Okay. No. So if we count your words, 195 is also okay. I'm writing to refer Miss Katie Robbins. We need comma here. Mostly nurses use complete name in their model answers in real official OET. They also mostly use complete name. But for doctors, just use Miss Robbins, okay? And let the nurses use this Miss Katie Robbins. For doctors, just Miss Robbins, okay? Who requires further investigations and management, okay? She was diagnosed with acute cholecystitis. She is being discharged today. So I usually give example like this. I get up early in the morning, full stop. I do my breakfast at 10 in the morning, full stop. I go to school at 9, full stop. What I'm doing? What I'm doing? Do you think this is language of which grade? First grade, fifth grade, 8th grade?
Don't know, doctor.
This is a language of kids, small kids. So when we are writing a professional letter, we need to join similar information together to write to make compound sentences. You can easily join these two sentences. She is being discharged today and would require, and she was diagnosed with cholecystitis and would be discharged today. Okay, maybe like this. But you have changed the order. So the order that I mostly use, first write the problem, then write what we want. Okay.
Okay.
So you were right. I'm writing to refer Ms. Robbins, who has been treated for acute cholecystitis. She is being discharged today, and your further investigations and management would be highly appreciated. Very easy to write like this. Okay.
Okay, doctor.
Ms. Robbins was admitted to hospital. No need to mention hospital. Okay. It's already understood. When you are admitting the patient, you are not admitting in, what should I say, in a shelter home like this. Okay. You are admitting in the hospital. Okay. So no need of this. Okay. Just write. I'm not saying it is wrong, but we don't need.
Okay.
This with complaints of
doctor.
fever, vomiting. Okay. Just typing mistake or a yellow discoloration of eye and hands. Okay. So when she was admitted, there was no yellow discoloration. I have written with no. Okay. There may be some
Okay.
misunderstanding. Okay. In addition, she has severe constant pain in. Okay. You are writing. No. You are writing with admission.
Yeah, I
And then
started
you
with
have written the
admission.
initial. It is okay.
Okay.
This order, this organization, I can also accept. Okay. But I would prefer chronological. Okay. Personally.
Okay, yeah.
Severe constant pain in her right upper quadrant, which was radiated is grammatically wrong, which was radiating with ing. Okay.
Okay, doctor.
To her back on assessment, we need comma here. Were her vitals were temperature. So what do you think? You're making it easy or difficult?
I thought it was happened in the past, so need the
You're making it difficult. Okay.
Okay.
Just you can use her examination showed temperature this, pulse this. Okay, like this, or her vitals were. No, her vitals were not okay. Yes. Her temperature was this, pulse was this. Blood pressure is normal, just skip it. Or respiratory is also normal, almost normal. Okay. Just skip these things.
Okay, doctor.
Okay, just write the pulse and temperature. Even the most important thing is temperature. Okay.
Okay.
She was commenced to antibiotics and painkillers for 5 days. Okay. Painkillers, you are writing to a doctor, to a surgeon, so not use painkillers is wrong. Okay. Use analgesic. Okay, analgesic.
Okay.
During hospitalization, we need comma here. This letter is a little bit difficult for nurses, but still, you people can see. When you will see doctor's letter, you will see the good language. Responded to the treatment and initial assessment was acute cholecystitis due to gallstones. Okay. So this, if we mention this in the purpose, you don't need to repeat the diagnosis again here. Okay.
Okay, doctor.
Then you can add today she has responded, her condition has improved and like this.
Okay.
And her antibiotic course has completed. Initially, so presented on this day with pain in right upper quadrant which was aggravated after meals along with nausea and was managed with painkillers. She represented no. Yes, you can write after 2 weeks.
Okay.
Her condition was not improved and her investigations showed this and that. Okay. Okay, so she advised importance of this. Okay, just improve a little bit. I wish if she could provide further investigation, including MRCP and sport to miss. Sport to know, yeah. Here is sport. Just mention about the surgery in the second part, not sport. Okay, which sport we need. Kindly arrange surgery if required. Her test will enclose. This is not needed. Okay, tests are enclosed. Okay. So just improve a little bit the conclusion. Overall, you are good. Your letter is good. It's not like typical for nurses. That is why. Otherwise, you are writing good letters. Okay.
Thank you, doctor.
Is Miss Anila. Yeah. Okay. And then we have Miss
Thank you, doctor.
Tesh Takshila, like this,
Yeah.
from Sri Lanka.
Yes, doctor.
Okay.
Yeah.
Okay. Just please bear with me, people. It will take almost 10 to 15 minutes to quickly read your letters. If you people start leaving, I will stop the class because you're not paying me anything. And then I lose motivation. It means you people start, getting bored. I'm writing to refer Miss Katie Robbins. Okay, so okay, so I'm writing to refer. First, let me tell you one thing. This is called indentation like this, something like this. So we don't need to leave blank line, blank space at the start of new paragraph. Okay, start paragraph from the start and leave one blank line between each paragraph. I'm writing to refer Miss Katie Robbins. We need comma here, who has been diagnosed with acute cholecystitis due to gallstones. Who has been treated will look better. Okay. Robin, okay, this is called repetition, okay? You people can see the name of the patient again in the purpose. So this is repetition. You need to use pronouns, okay? She is being discharged today, and therefore does not. This is the problem with many people. What is the problem? Over use of linking words, okay? Over use of linking words. So now they are thinking, this student is thinking that if I use therefore here, it would look very good. I'm using linking word and this and that. In OET, you need to be very careful. Just use it where it is important or where it comes naturally. Otherwise, it would not helpful. Okay. You will lose marks. Okay. She is being discharged today, and just and it would be great if to see her for further investigation. So this part can be improved, and your further investigations and possible surgery would be highly appreciated. You can write like this. Robin, please use Miss Robbins, okay? Not Robin, okay? Admitted to Newton Hospital on this state with severe, okay. This is a common mistake with many nurses. Let me explain you quickly, okay? So let us use here Miss, okay? Mrs. or Miss, okay? Miss Robbins. Okay. Can anybody point out what is the mistake here? Who is admitting the patient?
Was admitted.
Who is admitting the patient? Who is admitting the patient?
Me.
Miss
Should be
Sheila, okay? Let me.
Yes.
in passive voice.
Robin
Don't
was
need to
at
mention the hospital name.
Yeah, this is also okay. But in nursing letter, I can accept it. It's okay. But we can skip the name of the hospital. The main thing is grammar that I want to mention, okay?
Has been admitted.
No, has been, no, it is in the past, just was admitted. Okay. So this is the active voice, Miss like Sheila. You can add I, okay? I admitted Miss Robbins to the New Town Hospital on this date, okay? You can be a doctor, okay? So this is active voice. But here in OET, when you are writing letters, formal letters, you don't need to mention yourself. So you will use formal language. So how we can make the sentence formal? By using passive voice. Okay. So we will use the name of the patient at the start. Like this, okay? Miss Robbins
was
was admitted to New Town Hospital on this date. The complete sentence is like this by Miss Sheila. But here we don't need to mention ourselves, okay? So we will skip this part. So this would be our sentence. It was admitted, okay? Many nurses keep making mistake of active voice, passive voice. Please be careful, okay? So was admitted no. To Newton Hospital in this state with constant severe pain in her right upper quadrant and radiates. You people can see, I know. When I use this, people will make this mistake, okay? So when I am writing this first visit, you people can see here, radiates here, radiates, I have written no radiation, but relieves, aggravates. So I'm using present tense. Why I'm using present tense in the past visit? Why? Because this is case notes. Okay, this is just, you know, bullet points, what I've taken at that time. So that is why I'm using present. But when you will write a visit, past visit, you will use past tense, not present. So this is a trick that examiner uses. Okay, grade for your discoloration of this eyes as well as vomiting. On examination presented tenderness. Okay, on examination presented, no. And examination, comma, she had tenderness in her right upper quadrant and Murphy sign was positive. Okay. So is married woman with 3 children, lives with her family. Is this important for the surgeon? No need, okay. She has been smoked. She has been smoked is grammatically wrong. She has been smoking. Okay. Even we don't need to mention here for surgeon, okay. Drinking is also not needed to mention. Penicillin allergy, these things we don't need to mention because we are writing to a surgeon, okay. And your letter is already too long, okay. Before her admission, she visited 2 times to the hospital with complaints, with a complaint of pain. Where is the pain? You need to mention it a bit more. Okay. Multiple gallstones of this and that. Investigation is accept lipid profile. Just use her, you know, her blood investigation revealed the range lipid profile. Okay. I will hand over all the investigation reports with Robin. This is not needed. This sentence is not needed. Okay. Was treated with analgesia and antibiotics on discharge. She has no fever, pain, and condition is being, and her condition has improved. Okay, being improved is wrong. So overall, you need a lot of improvement. Okay, just see the discussion that we have done. So your letter needs a lot of improvement, but overall, you have tried very well. Okay, you can improve with time. Okay. So CFE tube is there? Is doctor or nurse? Nurse. Are you there? This name CFE tube. Are you there? No? Dr. Khubab?
Yes,
Dr.
I'm here.
You're there, okay. Okay. So are you doctor or nurse? We can see here. Okay, doctor. So word count 197, very good. I'm writing now. Nurses, you will see how the doctors write. Okay, I hope it would be good. Okay, I'm writing to refer Mr. Obin, who has demonstrated the clinical features of acute cholecystitis for further investigation and surgery if required. She allergic to penicillin and had not underwent any surgery before. Okay, so Dr. Khubab, how many letters you have written so far?
Sir, about 15 to 20. Sir.
15 to 20?
Yes, sir.
But you are getting somebody's help to improve?
Not yet, sir. I was just checking my letter from the model. Yeah,
Yeah,
I
the
was checking your
models that
classes.
I think you are checking from 50 models, 50
Yeah, I was checking
models.
from.
That is old
Yes, sir, I
style.
was checking.
Please don't follow them. That is old style, okay? Don't follow them.
Okay, sir.
Yeah, try to follow, you know, new latest criteria, okay? So here, doctor, as I mentioned in the explanation, we don't need to mention these things in the purpose. In the purpose is old style, okay? In the purpose, you need to mention the 2 things that we have already mentioned, okay? Just you can improve. We have already discussed a lot about the purpose, okay? Initially,
Yes.
on this date, she know we will use name of the patient, okay? Presented with if it is single complaint with a complaint of, okay, with a complaint of severe abdominal pain, which was aggravated after taking meals plural, okay? Her examination revealed my tenderness in right upper quadrant. So okay, this is like this. I get up early in the morning, I go to school, okay? Like this, so this is simple language. Just
Yes, sir.
join similar information together, okay? This sentence is okay. 2 weeks later, she used name of the patient at the start, okay? Presented with worsening of her symptoms. So you can see this is again simple sentence. You can add something else, okay? Her examination was normal, very simple sentence. Our investigation showed okay. So
Yes, sir.
elevated cholesterol level and multiple stones were detected on our ultrasound. You can just be a little bit exact about the size of stones would be a little bit easy. Little would the surgeon would like to know the size of stones, how many stones are there. So it is better to mention
Okay.
in detail the ultrasound report. Okay. Lipitor was added
Okay.
with a previous treatment. So you can with her previous treatment does not fit very well. Okay. So you can improve this part. Okay. On this statement, she got herself admitted. So got admitted, got using the got is informal way is not good. Okay.
Okay.
Was admitted. Okay.
Okay.
At Newton Hospital, so it should be capital due to worsening of our symptoms. Your discussion, this examination revealed this and that. Okay. So overall, your English is not bad, doctor. You just need, supervised, you know,
Yes,
that
sir.
right compound sentences and
Okay.
improve a little bit more. You can easily get B grade. Just, but still, this is not B grade. Okay, not can be
Okay.
close to B, but it needs improvement. Okay. Just try to take
Okay.
somebody's help if any tutor or any of your friends who have passed exam, they can guide you. Exactly. Okay.
Okay.
So
Thank you.
Sayyid Tajdar Hussain is there,
Yes, sir.
nurse. Okay. So first of all, word count is too much. 261. Please decrease your word count, and we don't need to write such a long purpose. It's very long. Just make it a little bit concise. Thanks to Ms. Robbins, a 42-year-old lady who has sinus symptoms consistent with acute cholecystitis. Now she is ready to be discharged and needs further investigation and ongoing management from your facility. From your facility is not needed. You're just adding for nothing, okay?
Okay.
Just in regard including MRCP and potential cholecystectomy, okay? And possible cholecystectomy, okay? So you can add a little bit here. On this date, Octono, please use the name, complete name of the month, okay?
Okay.
We don't use these things, November and no, okay. She know we will use name of the patient was initially presented with complaint of, okay. So now this passive voice using this passive, this is a common mistake. I already told all of you that this is a common mistake of nurses. So
Okay.
here she was presented, Miss Robbins was presented. So now it is wrong. The passive voice is wrong. She was not presented by somebody else.
Okay.
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 So Miss Sifi Dube, you are on the Facebook. Okay, I will mark your letter. Okay. Don't worry. So here passive voice is wrong. Just she presented with. We will use passive voice, but the patient is presented by somebody else. Okay, because for example, is a baby. Okay, Joshua was brought by his mother. Okay, is a baby. But here no, is wrong. Okay, which was severe and associated with nausea and vomiting. She reported her pain aggravate. So yeah, we cannot use present tense. Okay, means however relieved by very simple. Okay, this is very simple sentence as I read. Yeah, get up early in the morning, this and that. My tenderness was palpated. My tenderness was palpated. No, she had my. It's a little bit difficult letters for nurses to be honest, but still, you people can write. Okay. She had on examination. She had mild tenderness in right upper quadrant, and her vitals were normal. Some investigations were requested and advised. No, she was advised. Okay, she was advised. We need improvement here. After a week, if 2 weeks, not 1 week. Okay, is a 2 kilogram of weight loss, lose. No. There was no improvement. Just write there was no improvement in her condition and then write the investigations. Okay.
Okay.
Her report, her report normal except lipid profile. Just her blood investigations were normal except for deranged lipid profile. So we can use like this. Her investigations were normal except for deranged lipid profile. Okay.
Okay.
And okay, so what is stated? She admitted to hospital with severe pain associated with other complication. So overall, I can see you need a lot of improvement. You can see a lot of improvement. Just add the after class, send me a text. I will send you the model answer. You can compare, okay? And you can improve. You need a lot of improvement. I think you are new in writing, yeah? Dr. or Nurse Moise M, are you there? Are you there? No? Okay. Okay, so Safi Dube is on Facebook with us, so I will mark your letter. Can you hear me, on Facebook? I'm writing with regards to Miss Robbins is also okay, who was diagnosed with cholecystitis. She required further investigation and probable surgery. She, care for 5 days. Do you think is it important to mention she has been in our care for 5 days? What do you people think about this? This is not needed, okay? Vision on this date, Ms. Robbins presented with severe right upper quadrant pain, which radiated to the back, although diclofenac was administered. Jaundice was noted on the eyes in this. In addition, she had fever and vomiting. She had, this is grammatically wrong. She had fever and vomiting. Okay, she had fever and vomiting was noted. So you are making a little bit, difficult. Just write all the symptoms at the start, then write the examination, then write the treatment. Okay, this is a good way in OET. Write symptoms, write then examination, and then write the treatment. Okay, this is good way to write. Organize in better way. The diclofenac, morphine, antibiotics were administered for 5 days. Okay, and on this date, Robbins has finished the course of antibiotics and recovered well. Okay, you can write in separate paragraph. You can write at the end of above paragraph. Medical history on this, you don't need this. Okay, just directly write on this date. Okay. She presents, she know we need to use name of the patient. Severe pulmonary pain. The pain lasted for this. So you people can see this. We are writing 2 sentences about pain. You can easily join them together to write 1 sentence. She presented with a sudden severe pain and a pain in right upper quadrant, which lasted for 5 to 10 minutes. And was, aggravated by meals, something like that. So you can join similar information together to write good sentences. So now I'll look again here, okay? Various investigations were ordered, very simple sentence. Just some relevant investigations were ordered and she was commenced on diclofenac. You can join these 2 sentences together. And she was commenced on diclofenac, okay? On subsequent visit, 3 mm of 5 stones were confirmed ultrasound, okay, of note. No, she has had no surgery. This is not needed. You can skip it, okay? Smoking, drinking, we can skip all of these things, please, okay? You need to decide according to the reader. Penicillin allergy, you can also skip. Would appreciate it if you could investigate further by doing a MRCP and probably performing cholecystectomy, okay? She needs, okay. Overall, your English is good, okay, is not bad. It can be improved a little bit more, okay? It can be improved a little bit more, but, overall, your English is good. Yeah, just improve a little bit more. Don't write very simple sentences. Organize a little bit more. Okay, and improve a little bit more. Okay. Miss Radha is there. Miss Radha, I think she's not there. She was. Muzammil Sultana is there. Muzammil Sultana. No. Dr. Hamza is there.
Yes.
Okay. Dr. Hamza, let us see if you save my face or not. Okay. So he is taking my classes. Okay, and I think we have marked 7 or 8 letters so far.
Yes.
Okay, I'm writing to refer Ms. Robbins, who has been managed conservatively, very good, for acute cholecystitis, for further investigation surgery, very good. He is a surgeon, by the way. Okay, on this, Robbins presented with severe right upper quadrant pain, which aggravates This is my trick, doctor. I'm using aggravates because for me is the case notes. Just I'm taking the notes at that time. For you is a past visit. You cannot use present tense. Be careful, please. Okay. Which was aggravating, which aggravated, okay, after meals on examination, BMI was this and weight was this, okay. The rest of the examination were normal. This is not good, okay. So what we can do, Dr. Hamza, here is on examination, this is examination is also okay. Her examinations were normal except for a BMI of 31 and weight of 87.
Yes. Understood.
Okay, so Dr. Hamza, how we can improve this sentence? Let me write here for you. So as you can see, you have written on examination here, the rest of examination were normal. So these are two simple sentences. Even this is a compound, but these are two related to each other. We can easily write like this, okay? Her examination was normal. Even there was some tenderness, if you see there, except for BMI of 31 and even we can skip weight, okay? If you mention BMI, that is enough, okay? Yeah, like this. Okay, you know it is very easy, concise. Diagnosis was made and relevant and some relevant use some here. Investigations were ordered. She was conscious of dietary and lifestyle modifications. Very good. After 2 weeks, people, all of you nurses and doctors see this letter is very good. He is using very good language. Even there are some mistakes, but overall he is using very good language. Is well organized also. Presented with increased pain, not associated with other symptoms. Her investigation revealed. You can mention, there was no improvement. And increased pain is also okay. Revealed hypercholesterolemia, and on ultrasound there were multiple, 3 to 5 mm stones in her gallbladder. Okay, we can use her with parts of body. She was with diclofenac and atorvastatin and counsel regarding dietary habits. Very good. Okay. On this day, Mr. Oban presented with severe pain in radiating to back and associated with fever, vomiting, and yellow discoloration of skin and hands. And her pulse was this, and temperature this. Okay, so if you are maybe you are not able to type here, if you are using writing on paper, just see and this sign. Okay.
Exactly.
So and there was writable contender along with positive morphine sign. Okay, she was treated for acrososis with antibiotics for 5 days. Very good. Okay, well, the condition has improved and she is ready to be discharged. Please note she is allergic to penicillin and has 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 positive history of smoking and alcohol abuse. Okay, I will not say no, it is wrong because overall you have done very well. Okay, so if you mention very cleverly these things, even if they are not needed, still it is not a big mistake. It is not a mistake, no. Okay, in view of because you are mentioned just just like shortly and just so it's okay. It's okay. But I would highly appreciate if you could further investigate and manage her as deemed appropriate. Okay. So people, this is a good example of B grade. Okay. Very good letter. Okay. People, you need to see the difference. And doctor, if you just explain, as I have written already, discussed with you, when you joined me at the start, how were your letters? Some letters were good, but overall were not. Your English is good from the start, but you are not using typical OET style.
Yeah, exactly.
Yeah. Am I wrong?
Initially, I was using my own language. Yeah.
Yes, your own language and informal language, the language that we use in
it
the
was the
wards.
language that exactly that we use in communication with the other people in the
Even
ward.
even he has taken MRCS exams and these things. His English was good, but still he was not using typical and good language. And today you people can see even some sentences are even better than my model answer. So, but some sentences can be improved. But overall, it's very good letter, is B grade. Just people, please don't take a risk, is my advice. I am colleague like, I am your colleague. So I am not a classical OET teacher. I'm your colleague. Please don't take the exam without anybody's, supervision or, guidance. You will waste your time and money. Okay.
Exactly.
So this is
I
one example.
actually was consulted by my colleagues to get some
Yeah.
letters checked by you.
Yeah.
And
Because
even
your
if
friend got more than 2 years ago corrected by me. Yeah.
yeah,
Dr.
yeah,
Zulkarnain.
and if you agree, I think I can appear in the exam. Though I started preparation in just 10 days ago.
No, it's
So
okay. For me, your writing is B grade. Okay. If you keep practicing till your exam, that is on 28th. Yeah.
okay, okay.
Okay. So now next letter is Miss Varuni. Is there? Miss Varuni?
Yes, sir. I'm
Yeah.
here.
She is also VIP of course, but she is a nurse. Nurses improve slowly. Okay, not in 10 days. But let us see if she saves my face or not. Okay. I'm writing to refer Mr. Robbins, who was diagnosed with acute should be small. Okay. Cholestatic due to gallstone and is being discharged today. Very good. Compound sentence. Your further investigation and management would be highly appreciated. Very good. On this day, Ms. Robbins presented with possible symptoms of cholelithiasis. Okay, this is the mistake that many students make. You don't need to mention directly here in the body paragraphs the symptoms of the diagnosis. Write the symptoms. What were the symptoms? Okay, with pain that were in the per quadrant that was associated with this and that. So write the symptoms. Okay.
Okay.
Initial manual examination were done. So these were done. Then this is not adding anything. Okay. Just mention if it is normal or not. Because lifestyle changes and because his BMI was this. Okay. So you people can see this initial visit and she has made it, difficult for the reader to understand. So if you write like this, very easy. On this date, she presented with severe sudden onset pain in the right upper quadrant, which lasted for 5 to 10 minutes. It was associated with nausea and aggravated by meals, relieved by diclofenac. Examination was unremarkable except for this and BMI of this, and cholelithiasis was suspected. Some relevant investigations were ordered. So now you understand, the reader will understand the situation. The way you have written, the reader will not understand what happened initially on this visit. Okay.
Okay, sir.
On 2 weeks review, there was no improvement, and her pain was increased. We will use passive voice. Okay. Her ultrasound scan revealed multiple stones of 3 to 5 millimeter in the gallbladder. Okay, and also her. Okay, HD level was high, and for which lipitor treatment was commenced, and she was advised to repeat. No, we will use her diclofenac dose was increased. Okay.
Okay.
Okay, so repeat is a little bit not good. This paragraph is acceptable. Okay. On this date, Mr. Burn was admitted with symptoms of fever, jaundice, icterus, and constant severe radiating pain to the back, and severe pain which was radiating to back. Okay, this part can be improved.
Okay.
On examination, his her morphine was positive, and her BMI was this one. A 5-day antibiotic course. Okay. And diclofenac was started, okay, along with morphine. Why you are making this difficult? Okay, it's a very simple thing. Okay, she was commenced on antibiotics, morphine and diclofenac for 5 days. Make it easy. Don't make it difficult. Okay, is febrile and has her pain has subsided. Okay, we will use has subsided. Okay.
All right.
She has been advised to continue analgesic, weight reduction. No, to continue analgesics. This is no problem with parallelism. Continue analgesic. First form of verb and then noun. Okay, continue analgesic. So what would be the parallel form here? Reduce weight.
Okay.
Continue first form of verb and then this noun. Continue analgesic, reduce weight, and take or eat healthy diet. So this is not parallel sentence. You need to use parallel sentences. I would be grateful if you could arrange further investigation for Mr. Robin, including a MRCP and a color system if needed. This conclusion is very good. Okay. Paragraph is good. Conclusion is good. These two paragraphs are also almost okay. There's some, improvement is needed. Initial visit is not good at all. So overall needs improvement. Some, sentences are very good, but some needs improvement. So you are at the borderline, okay, like 290, 300, 280. So in this range, okay, at the border of,
Okay, sir.
yeah, needs improvement a little bit more. Dr. Sama is there? Dr. Sama is there? Okay. She cannot speak, I think, is on duty. Okay, Dr. Sam, is your letter. So first we will count words. So your word count is, so these, when there is no space here, it count the word, counts them as one. Okay, let us remove this. Then we will count your words. Okay. Moreover, we don't use an OET. Moreover, moreover, furthermore. So now let us count your words. So 244, please decrease your word count. You need to make things concise. I'm writing to refer Miss Robbins, a 3-year-old female who has featured consistent cholecystomy due to gallstones and would require your investigation for suspected cholecystectomy. Okay. What do you think, people, about this purpose? Anybody can tell me what do you think about this purpose? Even is grammatically okay. What do you think about this? Actually, Dr. Sam, this part is a little bit long. So I would advise you to write 2 sentences, would look better, okay? Even it is grammatically okay, but better write 2 sentences, would be easy for the reader to understand. So people, if you see here, this paragraph, even as examiner, I get irritated because I don't know, it is past medical history, is social history. She's writing, people, you can see here, this is the, past history, social history, these smoking, drinking, these things. And then she started her first visit, okay? First visit here, initial visit. So this is how you make things difficult for the reader to understand. Even your English is good, but you make things difficult for the reader to understand. So organization, paragraphing, these things are very important, okay? I have a drinker, she works as a waitress and diet fast food. Okay, so these things are not too much important for the reader. Reader is a surgeon, okay, not a physician. So here, okay, so has past medical history shows. Past medical history shows. This is not typical language in OET, okay? Please be careful. Just on this date, she presented with this, and which lasted for this. So this is not good language here. So in the right upper quadrant for 10 minutes, associated with nausea, her pain aggravated, was aggravated by meals, was aggravated would look better, and relieved by diclofenac tablet. Okay, you can skip tablet. Her physical examination was unremarkable except for maternal. This sentence is very good. This sentence is very good. Her lipid profile was deranged. Ultrasound showed multiple stones of this days. She was managed accordingly, as well as lifestyle modifications were devised. Very good, very good. Okay, this information was presented. Okay, people, this I already told you, people, you make these mistakes of passive voice. So was presented means somebody else presented this patient to you, okay? Like, for example, I'm a father. I come with my baby of, 6 months, 1 year. So you will say, if my son's name is Robin, okay? Robin was presented by his father, okay?
Yes.
Was brought by his father. But this patient is coming by herself. So Miss Robbins presented, okay. So which was constantly radiate, you people can see. So this is wrong.
And
Was
radiating.
radiating towards back associated with high grade fever and vomiting examination. There were tenderness. So with tenderness, we cannot use var. Tenderness is something singular, okay. There was tenderness, okay. With Murphy sign, and the Murphy sign was positive. Moreover, we don't use moreover in OET. You can use in additionally, her eyes and hands showed yellow discoloration. She was commenced to diclofenac, morphine, antibiotics. A review visit was advised after 5 days. This is, a review visit was advised after 5 days. What do you think about this sentence? It looks unnecessary, okay? Our letter is already long. Yes, you can skip on today's visit. Even the patient is admitted, there is no need to write visit or just write today, Mr. Robin has improved her condition, okay? If you're using has improved her condition, means patient is improving her condition on herself. Okay. If I say, I have improved my letter, what does this mean? So I have improved by myself. Okay. Grammatically, it means like this. So Miss Robin has improved her condition means she has improved her condition on her own. Okay. This looks like this. Okay. It should be today, Miss Robin's condition has improved. Miss Robin's condition has improved. And she has advised to, so she has advised is grammatically wrong. She is advised. She is advised. She has been advised. She is advised to continue analgesic and a lifestyle modification. Has advised. This is grammatically wrong also. And she has been advised to, adopt a healthy lifestyle. You can write like this. And we have the, I would greatly appreciate it if you could perform this and confirm suspected. Just if you could perform this and do possible surgery, okay? You don't need to write like this, okay? And do okay, Dr. Sama, what I can see there, I think you are a little bit new to OET writing. Your English is not bad. You just some grammatical issues, and you are not using typical language. It looks like you are a little bit new. You can easily improve with time, okay? You don't need to worry. But this letter is like C, C plus. Okay, you can easily improve. Are the doctors, the level of your English is enough to get B grade? Just you people need supervision and feedback and guidance. Okay, so Miss Kohli, Choli, whatever, okay, is there? Is, I think, who was this? I forgot the name. You have sent me letter on email. Let me see your name. Miss Nuna is there? I think it's enough. No, we have made a lot of letters. Okay, so you people are getting bored. Yeah. So at the end, before you believe, if somebody's letters were not marked, so it would be difficult for me to mark your letters. So I would advise you, those people who are with me on Zoom and on Facebook, because I'm your colleague. I'm not, like a classical teacher. Just I am now in the hospital, so I just went to see a patient right now. So I would advise all of you to, not take any premature attempt. Prepare well, get somebody's feedback, somebody's help, like any good OET tutor. So get somebody's help and get your letters marked. You are speaking, you can get a little bit of feedback. If you fail one time, then you need to pay, exam fee again. You have to pay, wait for some months. Then frustration, all of these. So please, decide and Model answer I cannot share in WhatsApp group and publicly, but if somebody need, you can text me, okay? Okay, any question, please? I think we should go off because it's too long time, okay? Anybody? So thanks you, all of you, for, for being with me for almost 2 hours. So what we should do next in next free class? Reading or speaking?
Speaking, doctor.
Speaking or reading?
Speaking. Speaking.
No, writing
Reading.
again, no, writing will come.
Speaking.
So we will decide about one of them, writing or speaking, and then the other module, okay? So thank you so much, all of you. Thank you.
Thank you, doctor.
Thank you, all of you.